Good afternoon, and thank you for joining the RLS Foundation's webinar titled RLS Advocacy, Preparing for Hill Day and Legislative Updates. My name is Adriana Colucci, and I'm the Communications Coordinator at the RLS Foundation. The 2025 Educational Webinar Series is an RLS Foundation program aimed at addressing topics relevant to the RLS community through monthly expert-led webinars. The RLS Foundation is using Zoom webinars for this program to ensure a seamless viewing experience. Confirm that your Zoom Workspace app or browser software is up to date and meets Zoom requirements. Following the live webinar, the recording will be made available for active members to view through their online member portal. If you would like to view webinar recordings and are not yet a Foundation member, we invite you to join online today by visiting www.rls.org. Please be aware that all attendees will remain on mute during the hour. Following the slideshow presentation, the speaker will answer only pre-submitted audience questions. Our speakers today are Phil Goglas II and Josh Fein of the Health and Medicine Council, who are the RLS Foundation's Washington representatives. Phil is the managing partner of HMC and has worked with the RLS Foundation for several years, during which he has helped the foundation make an important impact in the context of public policy, particularly by helping facilitate the annual in-person RLS Hill Day event. Josh has worked with the RLS Foundation for the past year and works closely with Phil to advance our priorities on Capitol Hill. Phil and Josh join us today to outline the Foundation's legislative priorities, present a brief update on recent events in Washington, D.C., and provide an overview on the importance of getting involved in advocacy. So thank you, Phil and Josh, for sharing your time and your expertise with us today. I now invite you to begin your presentation.
Great. Thank you, Adriana. And it's a pleasure to be here for those of you who I haven't met before. As Adriana said, I'm Phil Goglas. I work here in Washington, D.C. on behalf of the RLS Foundation. And I have for, I think we're coming up on about 7 or 8 years, or maybe a little more at this point. So quite a long time that I've been working with the foundation and with the community. So if I have met you before, glad that you are participating in our webinar. Josh and I will go through some key things, but we can go ahead with the next slide, Josh. So, of course, we always like to start off by thanking you for your participation. Anytime you advocate, you are sharing your story, and that is a big deal. It's not easy to be able to open up to strangers about what your journey has been, whether you're a patient, a caregiver, a provider, or a loved one. But by doing this, you are helping your legislators better understand what restless leg syndrome is and help them to better understand why they should be supporting our priorities that we're going to speak about a little bit later. The advocacy work that we do is critical to making your voices heard because you are giving a voice for the many in the community who are unable to use their voice or don't participate in our advocacy. But by you being active, you're lifting up the entire community. Next slide. So quick agenda for today. We're going to try not to be too technical here, but really be able to give some good background about what's happening here in Washington, go over the legislative issue reviews, and then, as Adriana also mentioned, answer some pre-submitted questions from the community that we think are incredibly important for folks to know. Next slide. So first, just with a very brief Washington update, I'm sure a lot of folks are more engaged on what's happening here in Washington now than they have been over the past, 6 or 7 years prior. But we are in the first session of the 119th Congress. This Congress was sworn in back in January of this year with a Republican majority in the Senate, a Republican majority in the House of Representatives, and a Republican administration at the White House. So with the Republicans having complete control over government, the two parts of Congress and the executive branch, there's been a lot of key things that they have been focusing on, mainly their budget reconciliation bill that I'm sure folks are very familiar with through news articles or different activities or from regular updates from the foundation. So we'll get into a little bit of budget reconciliation. And then, of course, what we always work on an annual basis is the appropriations process. And that, of course, is how much the government is funded at and what key priorities that Congress is asking for federal agencies to support. So 119th Congress, as I mentioned, Republicans hold a slim majority in the House of Representatives and the Senate. This has proved to be a rather interesting dynamic for both the House and the Senate, needing to walk a tightrope to be able to get bills passed. And one thing that we'll talk a little more about with HR1 and the reason why budget reconciliation operated the way it did was because it only needed a majority of votes. It did not need a bipartisan um, group of House members or senators to support that initiative. It was a strictly party line vote. So having just a slim majority does not allow there to be a lot of dramatic changes or significant things without having that somewhat agreeable middle within the party. And then, of course, HR1 was a major focus from January through July, and that bill was signed by the president earlier this summer on July 4th. Next slide. So, our appropriations process. Every year, Congress must pass appropriation bills. They must fund the government. That's something that they can't avoid doing. That's why we focus very closely on engaging with that process for federal dollars, for research, federal support for programs, again, that you'll hear a little more about. But that FY25 appropriations that was supposed to be done at the end of last year, the previous Congress pushed it into this calendar year. That deadline was March 14th, and Congress came up with a deal to just fully fund the government at a continuing resolution level through the end of fiscal year 2025, which is September 30th. What that means is there was no increase, there was no decrease. It was just level funding at current levels through the end of the year just to be able to keep the government open. The reason why they did that way was because they were in the middle of negotiations on the reconciliation of the Big Beautiful Bill, as they called it, and did not have the political capital to be able to pass an appropriation bill for the full year and negotiate at the same time. So they simply punted down and said, we'll figure this out later. A full year CR it will be. But we have seen that for fiscal year 2026, both the House and the Senate have been aggressively moving forward on advancing these key bills and making sure that they're marking them up, which just means they're reviewing them in the committee process, approving them, so that way they get either to the Senate or House floor, then they're able to pass and then go into conference. So where we are now is there's been a lot of recent activity in June and July on these key bills, and we just had, before they went into August recess, the Senate Appropriations Committee approved both their labor H appropriation bill and their defense appropriation bill, which are very important to us. And Josh will talk a little more about that later during our legislative issues review. But now that we're in the month of August, Congress is on recess until after Labor Day. When they do return that first week of September, they have a few short weeks to keep the government open past that September 30th deadline. What we have heard is there's most likely going to be a short-term CR from the end of September through sometime later this year to keep things moving, so that way there can be negotiations between Republicans and Democrats, both on the House and Senate side. As I mentioned before, reconciliation was done a specific way because you only needed a majority of members to support that. When it comes to appropriations is always bipartisan because you need at least 60 votes to advance anything on the Senate floor. So, Big Beautiful Bill, there are a lot of different things that were included in that large package. And the first thing I want to say is a lot of these things don't take effect until past September or November of 26 into 2027, some as late as even 2029. So it isn't anything that is going to happen right away, but some key inclusions in that Big Beautiful Bill are Medicaid cuts and different changes to how Medicaid is applied, different work requirements that are a part of that. Telehealth has been something that has become incredibly popular, so a focus on that. The Medicare physician reimbursement fix, which is something that they had been very focused on, and then some significant changes to student loans when it comes to how much folks are able to borrow. What's interesting about the Big Beautiful Bill is there were a lot of folks, us included, who were involved in just making sure that anything that Congress was doing did not have an adverse effect on patients, on our communities, on stakeholders who care about different things, whether they be through student loan caps or other priorities. The feedback we've gotten from Congress is they know that there are some things that they did not get perfect as part of the big beautiful bill, that they're going to have to go back and through another piece of legislation make some technical changes and fixes to that. So it'll be interesting to see how exactly all of that shakes out. But the bill is just a month old of being law, and I'm sure that, as many of you know, there are two definitive sides about what the bill actually does. So we'll unfortunately have to just wait and see on different interpretations and how we actually see the bill being implemented.
Thanks, Phil. I'm gonna be going through some of the appropriations, priorities, that are, really critical, for our community. But for those who don't know me, my name is Josh Fein. Work, with Phil in DC, to advance our priorities on Capitol Hill. I've worked in DC for 2.5 years now, but have been working more closely with the foundation since around, a year ago. So we'll start off with, a little more specifics on, what's been going on with the FY26, appropriations process. As Phil mentioned, previously they did conclude the process, back in March, with a full year CR. And, the first big step for the appropriations process is generally what's known as the president's budget request. This is essentially every administration, puts out a bunch of documents that kind of outline what they want, for the critical agencies, not just Health and Human Services, but Department of Education, Department of the Interior. So this year, the administration's budget proposal, which traditionally comes out in February and March, was significantly delayed, partly because of, just the new administration taking over, but they finally released it around June, even though Congress was already working on, the spending bills for this year that they started marking up last month. And basically what the budget request said is that they proposed cuts for NIH, the CDC, and it also proposed dramatic reorganization of the Department of Health and Human Services, the creation of what would be a new agency called the Administration for a Healthy America, which would combine several other, agencies within HHS, such as the HRSA and SAMHSA, a few others. But these efforts, were immediately not popular on Capitol Hill, both because of reorganization and consolidating, different parts of HHS. They also proposed to consolidate NIH institutes, from 27 to I think 15. And this was simply not very popular among both, Republicans and Democrats. So we knew that there was going to be pushback, on Capitol Hill, from what the administration wanted. But this was confirmed in, the recent markup that the Senate did a couple weeks ago, where they advanced both the Labor, Health and Human Services Appropriations Bill, but also the Department of Defense bill. But most importantly, in the Labor H bill, the Senate, which is controlled, by Republicans, with Susan Collins, the chair being from Maine, they did reject the administration's proposed reorganization and cuts for HHS. So they did not consolidate NIH institutes. They didn't dramatically change, the current structure of HHS. And instead of proposing a dramatic cut to the National Institutes of Health, like the administration wanted, or a dramatic cut to the Centers for Disease Control Prevention, we actually saw the opposite. NIH was proposed a small increase of around $400 million, and the CDC, was around level funded. So now I'm going to go into some of the more specifics on our legislative issues, and our specific appropriations priorities within the Labor H bill, and the DoD bill. But medical research is, of course, one of the RLS Foundation's, top priorities, every single year. RLS research, is funded at a few different institutes, the National Institute of Neurological Disorders and Stroke, or NINDS, the National Heart, Lung, and Blood Institute, National Institute on Drug Abuse, and the National Institute of Mental Health. Every single year, we join the broader community of patient advocates, asking for a substantial increase for NIH. So this year, that community-wide number, which the RLS Foundation was happy, to join them, was $51.3 billion, for NIH, for fiscal year 2026, which would be over a $4 billion increase. These funding commitments, are really important for our community, to advance research and ultimately find those, more innovative, better treatment options, in a cure for RLS. In the Senate bill that they marked up a couple weeks ago, they proposed 48.7 billion, which was a slight increase over the current FY25 levels. While it's not the 51.3 billion that we were asking for, it's still a positive in what's currently a difficult funding environment on Capitol Hill. So we were very happy to see, that small increase, in the labor age bill. Another part of the appropriations process, which is extremely important to our community, is something called the Department of Defense Peer-Reviewed Medical Research Program. It's something that we've been supporters of for many years. But for those that aren't, as familiar with it, just a quick overview of what the program is. It's essentially a congressionally directed medical research program, which is what it's called. But the PRMRP is a specific part of that, where every single year the Congress, but specifically the Senate, puts out a list of conditions to be eligible for study under this program called the PRMRP. It's a pool of money, and there are dozens of conditions that get included every single year. So we've been strong supporters of having sleep disorders and restriction a part of that list, and we've been successful in having it a part of the list for fiscal year 2025. And once again in fiscal year 2026, in the draft bill that was released a couple weeks ago. So we were very excited to see this. It's a big win for the community. And essentially what that gives our researchers is the ability to compete for hundreds of millions of dollars in funding every single year, to apply for, grants to do research, into RLS. The pool of money had been reduced from 370 million to 150 million for fiscal year 2025 because when the CR was passed, while everything else was level funded, unfortunately, this program, because of the difficulties of how it operates in the budget process, it ended up getting cut from 370 to 150 million. So while we have been asking for sleep disorders and restriction to be included within the list once again, we also did see that restoration of funding from 150 million to 370 million. So what we're going to be asking for, during our Hill Day in October is that although we're on the draft list, it's only a draft. The Senate, released it. They advanced it through, the subcommittee. But ultimately, if it's not passed, in a final measure, we're not going to be on the list. So we're going to be asking Congress, thank you very much, for including us in the draft bill that the Senate released, but please finalize the appropriations process for FY26. Please maintain sleep disorders and restriction, in the final bill, and then we move on to the next year. But this is something that gives our researchers, access to, a large, pool of grant money potentially, that they can apply for. And if sleep disorders and restriction isn't in it, then the researchers, they can't even apply. Now we'll talk a little bit about, another issue that's, very critical, to the RLS community and has been, for many years. And it has to do with the accommodation of patients, who do rely on low daily doses of opioids, to manage their RLS. So unfortunately, we've seen difficulties, which I'm sure many patients, some of them even on the webinar now, have experienced where low dose opioids, are effective, in managing your RLS symptoms. But we have heard, many stories of patients who unfortunately have had difficulties, getting their prescriptions, getting refills. So every year when we go to the Hill, we make sure that congressional offices understand that, for our community, we're not talking about, high levels, high doses, that lead to, addiction and, some of the, problems we've seen, with the opioid crisis. We've tried to communicate to Congress, that we're a little different, and to please, think about, patients in our community who rely on these low dose opioids, that's very effective, to treat their RLS. When Congress is, considering any legislation that might have to do, with limiting or cracking down on the ability to access, opioid medications. Education and awareness. Here's another program, that's of critical importance, to the RLS community. It's housed at the Centers for Disease Control and Prevention, specifically the Chronic Disease Prevention and Health Promotion Program. But it's the National Neurological Condition Surveillance System. And essentially what this is the CDC, is the leading public health agency, in the United States. And they do a lot of work, collecting data, tracking different conditions. And this one is specifically for neurological conditions such as RLS. So it's very important, to have a good understanding of how many people, the prevalence, different states, and the National Neurological Condition Surveillance System has been, it's around since around 2016, and it's been very successful in being able to, help us gain a better understanding about how many RLS patients there are, all around the country. So this program has been level funded at about $5 million for the past few years, and in the draft labor age bill, it was once again proposed, $5 million, which is level funding from FY25. Another program that's of critical importance for our community is the Chronic Disease Education and Awareness Program. This is a program that's been around since around fiscal year 2021, and it was established because there were many, chronic conditions, such as RLS, that didn't have a line item, within the CDC, which does important education and awareness work, around the country. So this program was created kind of similar to the PRMRP, where it's a pool of money where organizations such as RLS can apply for, and potentially gain access to grant funding of around $300,000 to $400,000 a year, to do dedicated, public health, sleep education and awareness activities, throughout across the country. We have been asking for $6 million for the CDEA for FY26. It's been level funded at $4.5 million for the last couple of years. It started at $1.5 million in FY21, so we've been successful, in slowly increasing the available amount of money within this program. But once again, we did see that they proposed $4.5 million, in the recent, labor age appropriations bill. So we were happy that with the administration having proposed to eliminate, the CDA and eliminate the Chronic Disease Center at CDC. We did see once again that the Senate, had rejected the administration's proposals. They maintained the CDA and all of the other education and awareness line items that they have. And finally, I know we have a list of questions that Adriana has prepared for us to answer ahead of time. But once again, thank all of you for your advocacy, and thank you for joining us today.
Thank you, both Bill and Josh, for that overview. Like Josh said, we are going to jump into some questions. We're going to start very broadly with some advocacy, and then we'll move into questions about Bill Day, which is our annual advocacy event. So I will just read off some of these questions. And the first one is a broad question. So how does public policy directly impact organizations like the RLS Foundation or even other sleep health nonprofits?
So Josh, I'm happy to take the lead on that one and then have you jump in. So what's most important is for an organization like the RLSF to be an engaged stakeholder. So that way, as decisions are being made on Capitol Hill, at NIH, at FDA, at CDC, that these folks who are making the decisions have input from stakeholders so they understand what effect their decisions will have on the community. It's important that members of Congress, especially, hear from their constituents about what their priorities are, why they should be supporting robust NIH funding. What does that mean for our community? Well, the more money that NIH gets, the more money that NINDS and other institutes receive as well, the more funds they're able to put into research. Research is critically important for us to get a better understanding of what RLS is, which then, of course, down the line leads to better and effective treatments and hopefully one day a cure. So all of that is critically important for us as an engaged stakeholder community to be very active in terms of educating lawmakers about where they should be supportive, what priorities should be, because there are a lot of other organizations who are out there doing the exact same thing. And there's an old saying here in Washington, if you're not at the table, you're on the menu. So you always want to be engaged with decision makers, making them aware of what priorities you have, why they should be supportive of it as well. And in Congress, what really drives that home is the constituent connection. So Josh and myself could go into every single House office, every single Senate office, and tell them that they should support all of our legislative priorities. And a good amount of them, if not all of them, we have great relationships with, and they'll say, "Thanks, Phil. Thanks, Josh. Sounds good." one question that every office will have is there somebody in my state or my district who is affected by this that can reach out and just share their story with us and let us know how important this is for them. So that space is critically important for organizations like the foundation to be active and to be on Capitol Hill to elevate the needs of the community and to just educate lawmakers, especially since we're in a new Congress and there are a lot of new House members and senators who maybe have never heard of restless leg syndrome before, but help them understand why it's important that they support all of our legislative priorities.
Yeah, I'll just add that you look at the P or MRP, for example, 2 years ago for fiscal year 2024, unfortunately, sleep disorders and restriction, didn't end up getting, included on the final list. But there were around 42 conditions, that, were on the PMRP for that year. Then you look at last year, we were very successful. We got sleep disorders and restriction back on the list. Very happy about that. But there are around 56 conditions on the list. If you look at the list that they just released a couple weeks ago, which we're on, there are over 60 conditions. So this just shows how competitive, the process is to get on a program like the PMRP. And every single year, it's getting more competitive, but it's also different. So just because you're on the list one year, it doesn't mean you're necessarily on it the next year. You have to be on Capitol Hill, every single year talking about, why it's extremely important that sleep disorders stays on that list. And every single year that we are on it, our researchers have access to potentially getting hundreds of thousands or millions of dollars worth of research. That matters. That makes a real impact, to our community. That's dedicated funds that sleep researchers can get that others from conditions that aren't on the list don't have access to every single year. It really does make, a difference for our community. So I think that it's really just stressing that you know, maintaining relationships with your congressional offices, not just coming to the Hill one time, but by engaging them, by writing letters, participating in our action alerts for various programs. It really is important, and ensures us that we're, at the table on the PMRP and that our priorities are being considered in what's a very competitive environment these days.
And I know the foundation, which is located in Austin, Texas, has a very long-standing relationship with our representatives. And so that really helps when you have that previous relationship, just building upon it every year. So our next question, what changes in policy or even the structure of our government systems, how might that impact patient access to healthcare coverage? And this might include firing of federal employees, changes at the Health and Human Services, and then is there anything that the public can do to anticipate any changes to healthcare access?
So, with the RIFs, the reduction in force that we've seen across federal agencies, it hasn't ended any programs, just the amount of workers who were staffed at a particular agency or something like that. So the work still goes on. So there were some folks that at NINDS, which is the primary institute for research on RLS that Josh and I are aware of, that were let go, but that doesn't mean that the RLS portfolio ends or that there no longer is support for research initiatives or things like that. They're just staff is having to cover more with less, people being able to manage those types of things. And I will say that the unfortunate side is there's policy, but then there's also the politics of everything, and they go hand in hand, and that's just how the system works. So, if there was a different administration in, would we have seen these cuts to NIH, these proposed cuts? Would we have seen wanting to consolidate NIH institutes? No, we probably would have seen significant proposed increases to NIH's budget or just different things. And the reality of where we are today doesn't mean that's where we're going to be next year or 4 years from now in a new administration. So it's most important, and I always stress to people, we just have to keep doing the good work that we know we're successful with, and we know makes a difference. So if you look at the president's budget request, for example, it proposed consolidating NIH institutes, eliminating a number of federal programs. The Senate Appropriations Committee came back and didn't do any of that. They didn't eliminate HRSA programs. They didn't consolidate NIH. They didn't eliminate NIH institutes that the administration placed their directors on administrative leave or things like that. And that's because it's a member-driven process and members listen very closely to what their constituents are saying. So anytime that there has been a change across HHS or funding being frozen or things like that, none of that stuff has stuck for more than a day or two because members of the House and Senate quickly receive outreach from their constituents, from their stakeholders, major research institutions in their states, and have flagged any of these actions as being troublesome, and they've worked with the administration to fix some of those things. So I know it can be a very confusing time in terms of there's so many new developments on a daily basis. But I figured, and this is going back through multiple Republican or Democrat administrations, is just really focusing on the bipartisan nature of the work that we do. We have great relationships with Democrats on the Hill. We have great relationships with Republicans on the Hill. It doesn't really matter who the chair and ranking member of these committees are because we have great relationships with everybody across the board. But that doesn't mean that it's not challenging nowadays in terms of trying to anticipate where things are going to go. But I do want to also make a point that Congress is the only branch of government that can unilaterally eliminate any federal agency or program or things of that nature because they're the ones that control funding. So an executive order may be signed saying that the Department of Education is going to close. The president doesn't have the authority to do that. If the Department of Education were to close, it would require an act of Congress. If NIH were to be reconsolidated, the administration cannot do that on their own. That would require an act of Congress. So it's very important to differentiate those two things as well, where there are a lot of things that have been happening via executive order that they're tied up in the courts now and things of that nature. But unless Congress actually passes a bill to codify any of that, it's not law. And the only thing that we've seen that has been codified into law is the rescissions package that eliminated funding for public broadcasting and some of these other initiatives that the administration had proposed. That's the only thing that we've seen codified into law as of now. Adriana, we can't
Yeah, I
hear
think
you.
you're on mute.
Sorry, guys. Next question is, how has research been impacted by any cuts to government funding? And have those cuts gone into effect? Have they been passed by Congress?
Yeah, and I'm not a researcher, so I can only speak as somebody who is familiar through working with a number of folks who are researchers. The biggest issue currently is there are a lot of unknowns. So because a lot is uncertain, it leads to ambiguity, which leads to an inability to continue to fund things because you're not sure if that funding is still going to be there 5, 6, 7 months, a year from now, if there's going to be the infrastructure available or things of that nature. So the changes that the administration has proposed at NIH, many, if not all of them, have been challenged in a federal court, and they're making their way through that process. The courts will have to make a determination if the administration is within their legal authority to make those changes. Members of Congress would argue, say, no, that's our job because we're the ones who decide the funding. And we saw that in a lot of the report language that the Senate Appropriations Committee just passed. Significant questions about what determinations were made about grants being terminated, who made the decision, what was the rationale behind it. And then there are a number of organizations and institutions that did have grants that were terminated that they were then reinstated through an appeals process or things like that. So I think the biggest issue from my perspective is just there is a big uncertainty about what the future may look like. And the other thing is when you look at the administration pointing to well, this is a DEI or this is a whatever they want to phrase it type of grant. Those were requirements under the previous administration. So in order to be considered for an NIH grant in the previous administration, you had to specifically speak to diversity, equity, and inclusion. You had to have a number of things to even be considered. Because these grants had that to be compliant with the previous administration, that was the rationale to eliminate them now without giving those folks the opportunity to say, here are the new rules to abide by when it comes to research. If you have a grant, we need to rework it to make sure it's compliant with where we are now. That didn't happen. That's why we're starting to see through these appeals processes where tweaks are being made and changes are being done that then now they're able to get those funds reinstated. So there has not been a congressional vote to slash research funding. The NIH and the Senate appropriation bill got a small increase in their overall funding. So there has not been any congressional action to cut research funding, and we don't anticipate seeing that coming at any point.
Okay, I guess you may have led into this question a little bit, but there are a lot of executive orders and policy that are held up in federal court right now. Do we know how long it would take for any resolution? And are any of those actions that are held up in court right now currently lawful?
So as soon as there's a lawsuit filed, there are oftentimes injunctions that are issued, which mean a pause to whatever is going on. So a lot of things that have been signed through executive orders have been under injunction, so they haven't been able to move forward with any number of things. It's making its way through the court system. I don't have a specific timeline of when they will, have a final decision, but I think it's going to be safe to say that a lot of these are going to work its way not just through the lowest level of federal courts, but probably many of these are going to try and get as close to, if not to the Supreme Court as they can, to get that determination of legality of actions that were taken by the administration or things of that nature. So that's what also leads to the uncertainty with research, because we don't know when these cases are going to be decided. What does it mean after they're decided and things like that. But there hasn't been anything that I would call controversial that has been challenged that has just been said, oh, we're going to be okay with that. There is, again, still a lot of ambiguity, which leads to a lot of concern because you're not sure where exactly to be able to move forward. If you're a lab, are you really ready to hire somebody new? No, because you're not sure if the funding will be there or not. You're going to look at cutting costs. We know of institutions that are not admitting any new PhD classes because they're unsure about what the future is going to hold and different things like that. But there is no definitive timeline on some of these rulings, but it is just making its way through the process. And if nothing else, I hope it gives folks hope that the three branches of government are operating in the way that they were intended. The administration does something. Congress says, well, that's our jurisdiction. This is what we're going to do instead. And then the judicial branch is there to say, okay, we're going to consider what the executive did. Is that within their right? Is that not? Here's what our judgment's going to be. And then there'll be some action from there.
Great. So there is a lot, policy is very much in the news. There's a lot of changes, a lot of actions. So above all of that, what messages can we focus on that will garner bipartisan support? And then could our efforts be enhanced by prominent spokespersons in sports, entertainment, or elected positions?
So I will just take the last part of that first. All of you using your voice really does make a difference, because at the end of the day, that's who members of Congress want to hear from. If we do have somebody who is, world famous, would that help to bring some awareness? Yes. But we know that we have been successful over the years in getting specific recommendations, specifically having restless leg syndrome mentioned in appropriation bills that have become law, seeing sleep disorders and restriction included in the peer review medical research program. All of that is because of the advocacy of our constituents and of our community. Um, I don't think that our message in any way is under threat given the current political environment because RLS is not a partisan issue. If you have RLS, you could be a Republican, and we know of Republican former members that have RLS. You could be a Democrat. We know of a former Democratic member who has RLS. So it isn't anything that is political in terms of being a Republican issue or a Democrat issue. And that's why we are very, very on purpose. We are very strategic about how we engage with Capitol Hill and making sure that we're not getting into the political fights. We're talking about bipartisan issues. We're talking about issues that are affecting people. We're not talking about the politics of the day or things like that. We can walk into a very conservative member's office at 2 o'clock and have a great meeting with them, and then at 2:30 be in a very liberal member office and have the same great conversation. So for us, at the end of the day, the most important thing is really focusing on that constituent outreach, making sure that they understand how important our priorities are, being aware of the politics of the day, but just not being swept up in it because a lot of that stuff doesn't directly influence what we do with the fund.
And you already touched on this actually, but can you just give us a brief summation of some of the past successes of previous RLS advocacy?
Sure. So we have been very fortunate to have, again, specific inclusion of restless leg syndrome clearly written in an appropriations bill. We have seen that there has been support from NIH institutes. We've had countless meetings with directors of institutes at NIH where we've talked about advancing research, advancing opportunities for not only our research community, but for us as an organization to collaborate and partner with federal agencies and NIH institutes on advancing critical key priorities. All of that we've been focused on. And I really just want to reiterate our focus has always been on the work that we know will make a difference for the community. So when the Chronic Disease Education and Awareness Program was created, the foundation was a key part of the larger coalition that ensured that the program was created through advocacy efforts on Capitol Hill, again, with sleep disorders and restriction getting included in that list of eligible conditions for study. That's an annual activity that has to occur. We have seen, again, some modest increases for NIH funding and support across the board, and none of that happens without the work of our advocates and our community.
We're going to transition into talking about Hill Day. So Hill Day is the foundation's annual event in person in Washington, D.C. So we gather with foundation board members, foundation staff, some physicians, and then, passionate advocates who want to share their story with their representatives. So we're just going to kind of go through a brief outline of what that day might look like. So the first question is, I am attending Hill Day. Where do we meet the morning of?
Thanks, Adriana. Yeah, generally what we've done in the past is that for those attending Hill Day, you're probably going to be staying at a hotel that's pretty close, towards the Capitol Hill, in the congressional office buildings. So we did last year, and what we'll probably be doing again this year, is that everyone is going to convene, at the Health and Medicine Council office, which is conveniently located right next to Union Station, if you're familiar with Washington, D.C. And it's a short 8-minute walk to the Senate office buildings, around a 10-12 minute walk, to the Capitol. So we'll be meeting there, in the morning of, October 6th, when our Hill Day is. We're going to have a little, training session just going over, the key topics to discuss, how the meetings run, what the schedule is. And then you're going to be with your, groups that you're going to be having meetings with, for the day. And you also get your individual schedule so that you can see which legislative offices, you'll be meeting with.
Yes, so thank you for mentioning that our Hill Day is Monday, October 6th. And I would like to mention that all of our information regarding Hill Day is on our blog. If you go to our homepage and you scroll down, you can find our most recent blog posts. So you'll find the address for the Health and Medicine Council, as well as some recommended hotels in the area. Okay, so continuing on, how can I prepare for Hill Day? Is there any training or any guidance?
Yeah, that's a
And
good question. Yeah, we understand, as Phil mentioned, advocate stories, patient stories, are really the most important part, of the advocacy work, we do. Educating members of Congress, your story really underscores the need, for funding all these programs, and supporting all of our different priorities. So we always try to make it, as easy a process as possible, for an advocate. Of course, advocates are experts on their stories, so that's why we always say that's the only thing you have to be an expert in is sharing your story, talking about your personal journey, how it's affected you, or whether you're a family member, a caregiver. So what we do is we help prepare you with everything else. So what we generally do is we have what's called a prep packet, which is essentially just a compilation of a lot of different information. Some of that are the legislative issues, that we discussed today. But a lot of it is also just kind of logistical information. So what the schedule is going to be. It's going to have our office address. It also is going to have some information just about Washington, D.C., travel, the airports, trains, that kind of thing. There's usually a picture of the Capitol Hill complex, just so you have an idea of, here's the Capitol, here's Union Station, here are this House and Senate office buildings. So all of that gets included into one document. There's usually also some tips and do's and don'ts of what you should say and what you should not say in a congressional meeting in the prep packet. So that's something that gets sent out to the advocates, usually around a couple weeks in advance. But we also usually have another training session similar to this, but more specific towards everyone who's attending Hill Day, and going into more detail, as I mentioned, on things like, where we're meeting on the day of, what your schedule is going to look like, but also just the flow and the cadence to how a congressional meeting, operates. Here's how long it's going to be. Here's who should speak first. When you should share your story versus when you're talking about the legislative issues. And we'll have a separate training session that goes into all of that, in much more detail, usually around a week before or a few days before, the event. So the prep packet, reviewing all that information ahead of time, and also attending the training session are going to be the two best ways to ensure that you're fully ready for Hill Day on the 6th.
I can also help with that as well. I work at the foundation and I work very closely with Josh and Phil organizing this. So my name is on the screen. You can email me, adriana@rls.org, if you have questions. Now, who are we meeting with in these meetings?
Yeah, so yeah, that's a good question. So generally, who we meet with is simply this. We generally have advocates go in groups or teams of around 3 to 5, maybe 4 to 6 advocates per team. That way, you can attend meetings who represent other areas of the country, from other advocates. But also so that you're not going into a meeting by yourself, because we know that it could be a little daunting, if you go into a congressional office and you're the only advocate there, talking about your story. So usually we have 4 to 6 people, in a team, but who we're going to be meeting with depends on, what part of the country you're from. So if you're from Michigan, we're going to be reaching out to your Michigan senators, Gary Peters and Alyssa Slotkin. We're going to be asking their offices, saying, there's someone coming from, Lansing or Grand Rapids or Detroit or wherever you're from in Michigan, to get meetings with those Senate offices. But then we're also going to be doing House meetings too and reaching out to your specific House members. So every advocate is going to have, of course, 2 senators that represent their entire states, but also one specific House member. So those are going to be the legislative offices for specific advocates. But every advocate will also attend meetings, for their peers, from other states, other parts of the country. So usually the way it works is we have a few different states who are together, a few different advocates, and everyone attends all of those meetings at the same time. But we have the constituents. So if you're from Michigan and we're in a Michigan office, they're the ones who are going to be taking the lead, but it doesn't mean that you can't contribute and share your story. It just means that the Michigan person is going to be, talking first, saying I'm from the local community. So you're going to be meeting with both your local, House member, your state senators, but then a few other meetings for senators and members from other states as well.
And how are these meetings with our legislative representatives? How are they structured?
Yeah, generally what happens is, these meetings they're slotted for around 30 minutes, but we usually say that the meetings, should take around, 20 minutes. And usually what happens is every person, who attends Hill Day and all the different groups is going to have either me, Phil, or another member of the Health and Medicine Council staff who is there to, lead them or lead all of you around the different congressional buildings, but also help facilitate, the discussion. So usually the HMC person, so if it was me, I would introduce the group, say we're with the RLS Foundation, and say, there's an advocate or multiple advocates, from your states, from your district, who are here to talk about, their stories. Everyone introduces themselves quickly. We hand it off to the advocates, first. The constituents, they share their story. We usually say around, 2 to 3 minutes, maybe up to 5 minutes max, to share your story. Everyone goes around, talks about their different experiences with RLS. And then after, usually the HMC person, but if advocates are comfortable with it, then you discuss the legislative items. So you say, we want this much money for NIH, the CDEA is important. Sleep disorders, please include that on the PMRP. You talk about the legislative issues after the stories, and then you leave some time at the end for questions. Some meetings, the staff member might agree with every single thing. They might have no questions, then it ends after 15 minutes. Other meetings I've been in, sometimes the staff member has 5 questions, and then it goes, a little longer.
So how long should my RLS story be, and what should I talk about?
Yeah, that's a good question. Yeah, I mentioned before, but 2 to 3 minutes. If you're in a smaller group, maybe 3 to 5 minutes. Essentially a little longer, than an elevator pitch. That's usually how we like to frame it. If you happen to be in an elevator with your senator, your House member, what would you say to them in that short period of time as you're going from one floor to the other? So definitely keep it on the shorter side, but I think, the most important thing to talk about, of course, share your experience, your diagnosis journey, what treatment options, are there, what treatments work, what treatments didn't. But I think what we always like to highlight is that, of course, educate them on the condition, but really make things as local as you can. So if you're from Arizona and you're meeting with your Arizona House office, tell them, where your children went to school, tell them what medical, institutions, what doctors, and where you went to. If you had to leave the states, if you had to go from Arizona to California or Nevada to get treatment, tell them that. They want to hear about what's happening. Of course, they want to know about RLS, but they want to hear about what's happening in their local community so that they know, oh, wow, like there really aren't enough neurologists and sleep specialists, in my area. That's an important issue that, needs attention. Or if there's a really great sleep, researcher in your area and you go to them, for care, that's another important thing for them to know. Really anything local so that they can remember the meeting and that it reminds them that they're constituents. They're not just a random person, like me and Phil, who are just talking to them about this, that there's someone that lives in the area that they represented, that possibly voted for them, or even if they didn't vote for them, it's someone that is a constituent and they directly, are impacted by what's going on in the community that they represent. So try to add in any local details, even if you think it's not important, where your kids went to school. It is important because it will help the staff, remember, the connection between you and their community.
Great. And then the last question, which I can answer, is am I responsible for my own travel, hotel accommodations, etc.? So yes, we do ask that you handle that on your end, whether there's a family member that you're going to stay with and commute in, there's a train, there's, ride sharing services. We do ask that you handle all of the planning for that and meet us at the Health and Medicine Council in the morning for a guided, drafted schedule of our day. The best source for that is on our blog. again at www.rls.org. But if you do have questions or if you want help finding something in the area, please reach out to me. I am more than happy to help work through that, answer any questions you have about Hill Day or accommodations or anything in between. And you can email me again at adriana@rls.org. So that sums up our webinar for today. So I want to thank Phil and Josh for spending time with us. For our audience, if you would like to learn more about upcoming webinars and events, please visit www.rls.org and click on the Get Involved tab. If you are interested in attending this year's RLS Hill Day in Washington, D.C. on Monday, October 6th, you can register online at www.rls.org/hillday. And then don't forget to join us next month as we recognize RLS Awareness Day, but we are recognizing it all month long. So we will be hosting an RLS virtual summit on innovations in patient care on Saturday, September 20th, and we would love if you can register and attend that all-day event with us. 8 experts will provide the latest in technology, treatments, and management approaches. Discounted tickets are available through September 6th. Visit rls.org/attend events for more information. All right, thank you so much for joining us today and have a wonderful day.